Section 4, Organization Prevention Strategies. The General Duty Clause from the OSHA Act of 1970 requires that, in addition to compliance with hazard-specific standards, all employers must provide a work environment free from recognized hazards that are causing or likely to cause death or serious physical harm. Workplace violence is a recognized hazard within the healthcare industry, and employers have a responsibility to reduce or eliminate this hazard. As a note, however, OSHA requires a safe workplace free from hazards. However, in many states, there is no clear directive on workplace violence. The OSHA-published Guidelines for Healthcare and Social Service Workers outlines 5 major elements for a workplace violence program. These are 1. Management commitment and employee involvement. 2. Worksite analysis or hazard identification. 3. Hazards prevention and control. 4. Safety and health training. And 5. Record keeping and program evaluation. These 5 elements are guidelines to help implement a workplace violence prevention program. And as always, be advised that some state plan states might have enforceable requirements. Some states will be briefly discussed at the end of this training simply to convey the importance of this. The first element is management commitment and employee involvement. Management commitment provides the motivation and resources necessary to effectively carry out a workplace violence prevention program. A commitment from management would include demonstrating organization concern for the employee emotional and physical safety and health, practicing equal commitment to the safety and health of all employees and patients or clients, assigning responsibility for the implementation of the various pieces of the workplace violence prevention program to ensure all managers, supervisors, and employees understand their obligations, allocating appropriate authority and resources to all responsible parties, maintaining a system of accountability for all responsible parties, establishing a program of medical and psychological counseling and debriefing for those impacted in any way by workplace violence, and supporting and implementing recommendations to safety and health committees. Employee involvement. The success of a workplace violence prevention program is equally dependent on employees. Employee involvement would include understanding and complying with the prevention program, participating in employee complaint or suggestion procedures covering safety and security, reporting violent incidents properly and accurately, participating in safety and health committees and making appropriate recommendations regarding violent or security incidents. Take training that covers techniques to recognize escalating agitation, assaultive behavior, or criminal intent. The second and very important element is conducting a worksite analysis. A worksite analysis or hazard identification is a step-by-step common sense look at the workplace to find existing or potential hazards. A threat assessment team or task force and patient assault team should be created to assess risks and make recommendations. This team should be made up of representatives from senior management, direct care nursing staff, operations, employee assistance, security, and others. The third element is hazard prevention and control. The Workplace Violence Prevention Task Force must determine risk reduction, intervention, practices and policies, and then implement them. As you begin the process, think about the following. Engineering controls. These could include enclosing nurses' stations and reception areas, comfortable waiting rooms, designing rooms for safety with 2 exits per room, thoughtful furniture arrangements, and better lighting, metal detectors, alarms, and employee safe rooms. administrative or work practice controls, ensuring adequate staff is available, communicating relevant patient history and behavior, proper reporting, record keeping, and training. Another area to consider would be personal protective equipment. If necessary, protective apparel is available. The fourth OSHA element is safety and health training. Training ensures that all staff are aware of hazards and how to protect themselves and coworkers. Workplace violence training is another fundamental to any successful workplace training program. This training should cover the following topics: the workplace violence prevention policy, risk factors that cause or contribute to assaults, early recognition of escalating behavior or recognition of warning signs or situations that may lead to assaults, ways to prevent or diffuse volatile situations or aggressive behavior, and manage anger. A standard response action plan for violent situations, including the availability of assistance, response to alarm systems, and communication procedures. Ways to deal with hostile people other than patients and clients, such as relatives and visitors. Progressive behavior control methods. The location and operation of safety devices such as alarm systems. Ways to protect oneself and coworkers, including the use of the buddy system. Policies and procedures for reporting and record keeping. Information on multicultural diversity to increase staff sensitivity to racial and ethnic issues and differences. And policies and procedures for obtaining medical care, counseling, workers' compensation, or legal assistance after a violent episode or injury. The final element is record keeping. Record keeping is essential to the success of a workplace violence prevention program. This will assist in identifying problems and allow for the development of an effective program. Maintaining accurate and complete hazard records is your roadmap to finding and fixing hazards. Record keeping checklist. This list is not complete and is meant to provide ideas for maintaining a workplace violence prevention program. Up-to-date recording in the OSHA log of work-related injury and illness. Thorough records of all incidents involving assault, harassment, aggressive behavior, abuse, and verbal attack. Training records. Workplace walkthrough and security inspection records. System for evaluating changes to determine their effectiveness. This might include employee surveys. Outside consultation of the violence prevention program for recommendations on improving safety. Program evaluation. Policies and procedures should be re-evaluated on a regular basis and following each incident to identify deficiencies and take corrective action. This also provides an opportunity to isolate recurring events, locations, or perpetrators.